At our table this morning, Congressman Jeff Fortenberry. He's a Republican of Nebraska, represents the 1st District, also a member of the Appropriations Committee in charge of those purse strings up on Capitol Hill. Thanks for being here. You've introduced a Rural Health Insurance Act.
Yes.
What is it and why is it important?
Well, one of the things that we're struggling with across the country is the real need for health care repair, particularly in the rural communities, many of which I represent. We have one health care provider. People are being completely priced out of the individual insurance market. This is affecting millions and millions of Americans. So, for instance, a farmer writes me and he's telling me the price of corn hovering around $3, his property taxes are X, but he's having to pay up to $40,000 for health insurance premiums combined with the deductibles. It can't be done. So people are facing these horrific choices of either going bare without insurance, or a member of the farm family has to leave the farm to go seek employment at a job that they don't want to do, disrupting the farm operation, simply because they need the health care benefit. And in some cases, people are just shifting that cost to the government out of necessity by going on Medicaid. I just think this is wrong. So trying to provide a better atmosphere, particularly in rural communities where there is more health care choice and affordable insurance products, is the purpose of the bill. I'm very happy to say that the contents of the bill are embedded in the Farm Bill as a component of the entire Farm Bill. So what this is going to do, if we're able to get it through, is subsidize what we call qualified agricultural associations to form their own risk pools. So right now, a person who has access to corporate insurance or government insurance, they can pay their high rates, but they can pay more reasonable rates. A person in the individual insurance market, which sometimes will include farmers and other people in rural communities, are paying astronomical rates that are not affordable. So this is wrong and it's unjust, and it can be easily fixed. So this component of the Farm Bill takes some of our resources, just like we do in subsidizing crop insurance, rural housing, rural economic development initiatives, because we see the need to fix a market system there by allowing for new types of associations to form that would help bring about new insurance products in those markets and substantially reduce cost.
How much money do you want to spend on subsidizing health care for farmers?
Well, that's not exactly the right framework. Subsidizing health care for farmers.
I thought you said subsidizing.
It is.
Okay.
It's subsidizing the opportunity for new groups, just like major corporations have a large enough group of employees to be able to have affordable insurance because everybody shares the risk. When you're out there on your own, you're not part of a group. So rates are astronomically high, and it's causing great duress and harm in rural and farm and ranch country. So the idea here is to take a fairly minimal amount of money and subsidize the startup formation of what we call risk pools, so that qualified agricultural associations, let's say a large co-op sells seed and fertilizer, why couldn't they sell health insurance as well? But these are hard to start. They're complicated, and there's a lot of risk to them. So there, in my view, there is a role for public policy, a public subsidy there, just again, like we do in rural housing and rural economic development, to stimulate this part of the market, bring more choices for health insurance into the marketplace, and substantially lower costs, and stop the disruption that's happening to farm families across the country.